Tonight, we're keeping them honest with an example of just how much money can be made treating sick Americans. In downtown Denver, a company called DaVita just moved into this brand new $101 million office tower, complete with fountains, gardens, even a suspended ski gondola inside for private meetings. So what does DaVita do? It runs 2,000 dialysis clinics across the United States, and that has added up to a $7 billion business. A dialysis empire run by a guy who dresses like one of the Three Musketeers, lives by his company's slogan, all for one and one for all, and in company staff meetings, leads his employees, who he calls villagers, in cheers.
Now, yo, DaVita! It's so good to get out of that CEO costume and back in my regular clothes.
Ken Theory is his name, and with an estimated $15 million a year, the Wall Street Journal says he's the best compensated CEO in Colorado. So why should you care? Because most of his company's revenue comes from a single source: taxpayers. More than 2/3 of DaVita's revenue comes from Medicare and Medicaid payments, which is why the allegations you're about to hear about how DaVita has been billing the federal government are so alarming. If the allegations are true, the company threw away hundreds of millions of dollars of medicine, and you paid for it. It could be the largest case of Medicare fraud in U.S. history. Here's Drew Griffin.
That's good.
It was just by chance Dr. Alon Vayner, a medical director at dialysis clinics in Georgia, was discussing clinic procedures with one of the nurses, Daniel Barber. And the two say they saw something they believed was very wrong. Medicine, lots of it, was being tossed in the trash, and the clinic workers were being told to do it.
When we sat down and we started talking about it and getting into details, we actually realized exactly what's going on.
The alleged waste was being carried out on a massive scale, and the nurse and doctor say they knew almost immediately just why. They claim it was a way for their company, DaVita, to defraud the government, overbill Medicare and Medicaid, and make a fortune.
We're talking about a huge amount of money.
We're talking about in the hundreds of millions, easily, of the profits that this company reaped from those schemes, only from those two drugs. Hundreds of millions of dollars.
And because we're talking about defrauding Medicaid and Medicare, that's hundreds of millions that you, the taxpayer, pay for. Vayner and Barber say the alleged fraud schemes they discovered were going on at the company's clinics all across the country, more than 1,800 of them, with tens of thousands of patients. Multiply the numbers, the waste, and the billing. Dr. Alon Vayner says it was all a deliberate strategy.
Absolutely. It was just a scheme in order to fraudulently increase and maximize and boost the Medicare revenue, Medicare payments, so therefore fraudulently increase our revenue.
Here's how Dr. Vayner says DaVita instructed its nurses to administer a 100 milligram dose of iron called Vinifer.
This is Vinifer. It's iron.
And how much is this? I mean, how many?
That's 100 milligram. Okay. So for example, if a patient would require this dose once per week, you'd administer 100 milligram, waste nothing, and charge Medicare for 100 milligram. What DaVita did, instead of this one vial, they gave 50 milligram out of this vial, residual, trash. 25, 75 to the trash. 25 again, 75 to the trash. So essentially, two whole vials. You have one vial that could have been given without waste.
The more vials DaVita used, the more DaVita was able to bill the government. Vayner and Barber claimed they tried to call attention to the massive waste and tried to get it stopped. But they say they were basically told to stop causing trouble themselves and continue following the company's protocols.
That's what upset me the most, and that's when I went to Dr. Vayner and I said, Dr. Vayner, I can do that.
Barber says he quit his job and left the clinic rather than continue where fraud was going on. Dr. Vayner claims the company punished him for speaking up.
Of course, once they found out, they did not renew my medical directorship or my practice. We are three physicians in our practice, and it was a significant loss of revenue.
Today, both men have filed a whistleblower lawsuit under the U.S. False Claims Act on behalf of the U.S. government. charging DaVita with massive Medicare fraud. They stand to make millions if DaVita is found guilty. DaVita's CEO wouldn't talk, but the company's attorney, Kim Rivera, did.
The allegation is pretty simple, that DaVita was being paid to throw away medicine and came up with schemes, as the plaintiffs call it, grids to maximize profits in terms of throwing away waste. What is DaVita's response?
Well, that's just wrong. If you look at the facts of the case, first of all, the doctors make dosing decisions. When you look at what the practices were, decisions were being made by doctors based on what was in the best interest of their patients. And they took into account a variety of things. You can't just look at one issue. You have to look at things like infection control, what the patient's going to do, how the patient's going to do with particular doses. And so during that entire time, what the doctors did was appropriate.
But other companies, including DaVita's main competitor, used smaller vials, smaller combinations, limiting what was thrown away. DaVita only reiterated to us its decision to throw away medicine was for sound clinical reasons and never to increase wastage. Attorneys Lynn Wood and Marlon Wilbanks, who claim DaVita made as much as $800 million overbilling the government, say that defense won't hold up in court.
It's not just the taxpayers that are the victims here. It's the health care system.
It doesn't take a graduate degree to understand what's going on here. This is just dishonesty.
DaVita denies that and vows to fight this case in a Georgia court. But earlier this year in Texas, though denying it did anything wrong, DaVita settled a similar case for $55 million. Pat Burns with the watchdog group Taxpayers Against Fraud says the bigger problem is even if a company gets caught cheating the government, the company executives never seem to face any punishment. Fines are paid, business continues as usual.
The way it's set up right now is if the fraud is not caught, then taxpayers foot the bill. If the fraud is caught, stockholders foot the bill.
Burns and others have been arguing for much harsher treatment when companies are found guilty of defrauding the federal government. He points to record billion-dollar fines, particularly in the pharmaceutical business, that are paid but executives don't get punished and the companies continue to do business with the government. In fact, one of DaVita's defenses to CNN is that the federal government itself has declined to charge the company with wrongdoing, even after reviewing the fraud allegations.
The government has come in and thoroughly investigated what the allegations are, and in both cases, the government decided to drop it and move on.
The U.S. attorney did decline to prosecute the case, but says the decision should not be construed as a statement about the merits of the case.
U.S. Department of Justice simply doesn't have the people.
Pat Burns says the short-staffed U.S. Department of Justice declines to join lawsuits all the time, instead allowing private citizens who hire private lawyers to essentially prosecute for the government. Which brings us back to one doctor and one nurse who stand to make millions if those allegations of fraud are proven true. The biggest winners, though, in their lawsuit could be taxpayers. The U.S. government will recover the bulk of whatever they win. They and others like them are essentially the U.S. taxpayers' deputies in the fight against health care fraud.
Are you surprised that you guys have to defend the U.S. taxpayer and not the U.S. government knocking on this door?
I'm not surprised. It's not easy to come forward and stand up and tell the truth, but it's the right thing to do.
Their case set for trial later this year.
Drew Griffin joins us now. Drew, is there a chance DaVita just settles this case like the one they settled in Texas and then just put all these allegations behind them, continue to do business with the government?
You know, the attorney for DaVita couldn't rule that out, Wolf, but insists this time the company is going to fight the allegations. And as for continuing to do business with the government, that is the bread and butter of DaVita's $7 billion business. More than two-thirds of the company's revenue comes from treating patients on Medicare and Medicaid, so DaVita needs the government, Wolf, and will most likely do everything it can to make sure it has that contract in place so it keeps working.
Yet, even with all that money at stake, Drew, and so much fraud being alleged here, why isn't the government's own lawyers taking up the case? Is DeVita right in saying that is proof there is no case?
Well, it is a fair question to ask. Where are the government's lawyers? And I don't know the answer. The U.S. attorney here in Georgia would be the one to push this case. Congress has set aside more than $600 million specifically to prosecute healthcare fraud, but the U.S. attorney based in Atlanta has decided not to intervene. Does that mean that she thinks that this is a bad case? She wouldn't answer our calls. All we can tell you is, in a letter, the U.S. Attorney's Office stated its lack of prosecution should have no bearing on the merits of the case. And a reminder, Wolf, if these two guys win, the doctor and the nurse win, whatever settlement they do get, the biggest winner of that settlement is going to be the federal government.